So, what is the best piece of advice you've ever gotten as a trainee?
That's a challenge. I think I would say, keep your eyes open and your mouth shut. For the most, there's a lot you can learn from your patients solely from looking at them. Again, physical diagnosis is extremely important for vascular surgeons because you can tell by somebody who has lack of hair in their legs that they have peripheral vascular disease. You can tell by looking at the asymmetry of the face if they've had any neurologic issues. So there are lots of things that keep you off vascular health. So it's a diagnosis of exclusion, but you also have to be kind of like an investigator for everything. So it's a very challenging field.
Awesome. Okay. So you recently traveled to Budapest for a talk, right?
Yes.
So of all the cities around the world you've lectured in, which one made you want to stay there?
Paris, France for the beautiful architecture, Italy for the food, and Greece for the beautiful ocean and nice people.
Yeah, good answer, yeah. Okay, so most important question, what's your favorite vessel to operate on?
It's kind of like asking who's your favorite child. I guess I'm pretty more known for operating on the aorta of the carotid. They're both a beautiful organ. Each has its interesting problem. The aorta is the one I probably operate now, and both of those are operating a lot. So I think those are my two favorite structures to operate on.
Okay, and then finally, why vascular surgery?
I took a long, circuitous road to get here. My father was a vascular surgeon. I worked for him as an aortic and as a vascular and I vowed I would never go into this field. But it kept drawing me back because it's fascinating, it's technically demanding, and you can't lie to yourself, because if things don't work, blue is bad, pink is good. So if the bypass is not working, the foot's not getting enough blood flow, it's pretty easy to show you right away. Somebody's having a stroke after you've done carotid, obviously something went wrong. And in the aortic surgery, obviously there's a life or death situation, so you can't really hide anything. And that's what drew me to it. Other fields, I kind of say, oh, it's the patient's problem, not my problem. This field, everything's my problem.
Awesome. Thank you for your time.
Certainly, my pleasure.